and welcome to Dr. Nora's Clinic. In today's episode, we're going to be giving some thinner lips a little bit of voom. Let's get inside and get injecting. Marima, do you want to come in? So Marima, I understand you come in for some lip fillers today, is that right?
Yes.
Perfect. Any questions or any glaring questions you want to ask me before we get started?
I just want to make sure that they're not too plump, too big.
Not too plump, not too big.
Yes.
Perfect.
And end result.
End result, perfect. Is this the first time you've had lip fillers done?
Yes.
Any anxiety or nervousness?
I'm
a little bit nervous.
Yeah.
You'll be fine, absolutely fine. So what we'll do today is I'll go through what the procedure is like, what you'll expect to have as well on the table, and what the results are going to be like too. So Merriman, just to talk about the filler itself. So it's a non-permanent, so it's not permanent, filler that lasts up to 6 to 9 months in the lips itself. It's made up of something called hyaluronic acid. Now, we naturally have hyaluronic acid in our bodies. It helps us to keep ourselves plump, our skin plump, vitalize, volumize, and hydrated as well. So by giving you a man-made version, it will integrate naturally with your tissue over about a 2-week period. So you'll start to notice a better effect in about 2 weeks' time.
Okay.
And then hopefully you'll look a lot plumper, more hydrated, and more volume in those lips as well.
Okay. Less wrinkles.
And we'll also get rid of the wrinkles as well. Perfect, no problem at all. In terms of the procedure itself, so what I'll do first up is just numb your lips with some numbing cream.
Okay.
That will make your lips feel quite tingly. It might feel a bit bigger as well, but don't worry, that's just going to be a temporary effect for about 20 minutes or so. The filler itself does actually contain some anaesthetic in it. You don't have any allergies to anaesthetic, do you? Perfect. So as we go along with our fillers, it's going to feel a lot more number the longer we inject, or the more injections you'll have as well. So you won't feel a thing.
Okay.
Perfect. It will, of course, it's going to be uncomfortable naturally because it is a needle going into your skin. There will be some bleeding and possibly some bruising as well, which can take up to 5 days for it to settle down.
Okay.
It will swell up. That is something that I always tell my patients, it will swell up on the table and also for a couple of days after. So it'll be swollen today and it'll be even more swollen tomorrow. And you might even come back to me in 2 weeks' time when we catch up and say, you know what, I really liked what my lips look like the day after, because a lot of people like that bigger, plumper look. But we'll see how we go after.
Okay.
You'll expect.
Okay. Can you have arnica?
You can, yeah. Arnica tablets, arnica cream is all fine. That will reduce the bruising as well, which will be quite good. You can expect the swelling to decrease by about 30 to 40% over the next 3 to 4 days or so. And because of the way that the hyaluronic acid integrates with your natural hyaluronic acid, it can take up to 2 weeks for it to fully form for you to get that end result. Now, there are some side effects and complications that we need to talk about, but they're very, very rare, but it's important that you should be aware of those.
Sure.
In some situations, there can be a risk of nodule formation. Those are lumps that can happen after a period of weeks once you've had your filler. Again, it's a very rare complication. If that's the case, come and see me. Another rare risk of having this sort of procedure done is skin death as well. And that's because if the filler is injected into an artery or into a blood vessel, that will stop the flow of blood into that area, causing necrosis or skin death. Again, it's a very unlikely cause and a very unlikely complication. Like, hopefully it won't happen. It's not happened so far, so you're not going to be the first. Fingers crossed.
No.
But say, for example, that did happen, then we have something called hyalase or hyaluronidase, which actually dissolves the filler and brings the skin back to normal again.
Okay.
So that's something that we can treat if need
Sure.
be. Any questions so far?
No, that sounds fine.
That sounds fine. I've scared you enough.
Yeah.
This is basically just what we've gone through anyhow, but have a read of it. So our lovely patient is now signing away her life, aka signing the consent forms. It's really important that if you are having these procedures that your practitioner does go through all of the consent, making sure that you're aware of all of the complications and risks that can happen. In certain fillers, there can be a slight risk of blindness, which is a very rare complication, but it's really important that your practitioner is aware of this and has told you about this as well and knows how to treat this. Now, I say this has only been 2 cases in Australia so far, and about 70 cases in the world, so it is an extremely rare complication, but it's something that you need to be aware of if you are having fillers. That's lovely, good. So Marima, I'm just going to get you by the wall and just take some before and after pictures, if that's okay. Just going to ask you to pop your head nice and straight for me. Yep, perfect. And we're going to do a couple of funny faces. So first up, just a natural face. Smiley face with your, yeah, perfect. And blow me a kiss. And
Prison thing.
it's a mugshot. It's beautiful. Look at that beautiful pout. So it's really important that your cosmetic practitioner does take some before and after pictures to show you the difference, and doing them in different styles as well. So making sure they're doing it front on, 45 degrees and 90 degrees, and lots of different faces. And that way you can tell what difference has been made. All right, Marima, it's time to get injecting. Are you comfortable like that?
Yes.
Wonderful.
Oh my God, I've changed my mind.
Change your mind. All right, so to start with, we're going to numb up those lips with some anaesthetic cream because we don't want her to be in discomfort whatsoever. So we'll get plenty on the lips. Now, Marima, if you want to lick your lips, do it now.
Done it.
Because you don't want to be licking this because your tongue will go numb.
Okay.
All right, and then I'll give it a clean after. So it will feel a bit tingly, a bit funny, a bit swollen, but that's entirely normal. Yeah, perfect, beautiful. I'm going to leave you there for a couple of minutes just whilst I get myself ready. You comfortable?
Mm-hmm.
Beautiful.
Thank you.
Now it's time to set up my trolley. And for this I've got a basic dressing pack, which has a pot that I can put some chlorhexidine wash in to keep that sterility, because we want to make sure that it's a clean procedure to avoid any risk of infections. And also has some gauze as well, because as I said earlier, there will be some bleeding and we want to minimise that as much as possible. Now, you'll notice that I do have a squidgy man. So this is for you.
Oh, thank you.
You're welcome. You can squeeze him when you're feeling like you hate the world and you want to strangle someone that's not me. Perfect. So it's really important that when you are having fillers done, that your practitioner always primes the needle. Now what that means is when they place the needle onto the syringe, they squirt a little bit of that filler out and just tap it and make sure there's no air bubbles inside, because the last thing I want to be doing is injecting air into the lips. Yes. Alrighty. Perfect. Okay. How are you feeling?
I'm feeling good. Numb.
Yeah. Numb. Perfect. All right. So what I'm going to do is just wipe off some of the cream. So just open your mouth for me. Look away.
Okay, I'll close my eyes.
Close your eyes. Go to your happy place where you feel. Go to Ellie Beach. That place is gorgeous.
Oh, no, this is beautiful.
It is stunning over there. All right, so a series of injections. They will feel a bit funny and your lips will feel big, but that's just because I'm injecting.
Yep.
So
Open or close?
just open it ever so slightly for me. That's wonderful, thank you. Sharp scratches coming through. Well done, well done. How was that for your first one?
Yes. Sharp scratch.
Sharp scratch indeed. So we're going to do a few more of those, and as we go on, it will feel more numb because of the anaesthetic that's inside. Well done. Squeeze that ball for me, Marima. Well done. Well done. You're doing really well. Well done. Big breathing. Beautiful. Well done. It's already starting to take a nice shape actually. I've only put in 0.1 of a mil on right side of the upper lip, and you can see it's already starting to come out a little bit. It's very subtle, but what I did notice, Mariam, is there was a small little defect that you had on your lip. So what I'm trying to do is trying to blend it into your actual lip so it's not as prominent.
Yeah.
That looks very nice. We're going to carry on this side now. So a couple more sharp scratches. Beautiful. Doing really well. Well done.
Trust me, I do my own lips, Marima, and in front of the mirror, and I'm always like, oh, what am I doing to myself? But it's worth it. It'll be worth it for sure. No sharp scratches again. Well done, that's particularly painful. Oh. Beautiful. So there we're just correcting the Cupid's bow, trying to get it nice and prominent and keep that beautiful feminine shape that we have there in our Cupid's bow. And again, just pop your mouth open for me. Lovely. Well done. Fabulous. So we come around the top of the bed and do the other side of the Cupid's bow. Sharp scratch. Well done. Beautiful. So again, just being able to flick the needle around the Cupid's bow keeps that nice, sexy Cupid's bow that we want. And look at that. Take a look at her lips already. They're really plumping up. Let me show you a midway sneak peek. So that puffiness, remember, it will go down by about 30 to 40% over the next couple of days. And it will still integrate with your natural hyaluronic acid as well. But yeah, it does feel a lot more puffy than it actually is, but actually it suits you nicely. So I'm just gonna do a little on the lower lip just to get that anaesthetized as well. All right, a little sharp scratch coming. Well done. Well done. Beautiful. So right now I'm just using the fanning technique, which is using one injection point but going in multiple directions. It's a lot more comfortable for the patient, and it allows you just to spread the product nice and evenly throughout the lower lip. Just going over the borders of the lips to get that nice definition. And then we'll go into the body and do some fanning to get that volume back up. Beautiful. Okay, so what I like to do midway through my treatments is just do a mid-facial assessment just to see how we're going. So we're halfway there with the syringe. So it's always good to ask the patient to do a couple of motions with their mouth. So just look towards you, Marima, and give me a smile. And give me a perfect and a big smiley. Yeah, lovely. So it's great. Well done. So I'm just checking to see where the product is, just to make sure that there's no major lumps. I'll be massaging it right at the end just to smooth it all out and make sure it's nice and supple. Lovely, and just close your mouth for me. And a smiley. Yep, and then a big smile, and then a blowy kiss. Beautiful. Look at that kiss, guys. That's very, very nice. Very nice. Show us again your kiss. Woo! Wow, 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 wow. Guys, back off, okay? All right. So what we're going to do now is a little bit of tenting on the lower lip just to even it out and bring it out a little bit. So with this one, we just do some vertical strips, so vertical linear threads. So just open your mouth for me. Well done. And this just helps to roll out that bottom lip. Beautiful. And close your mouth. Yeah, wonderful. Very nice, very nice. And you can see how the lip has just rolled out a little bit more. Once the inflammation and swelling has gone down, that will soften down as well, and it just give her that nice shape that she deserves on this gorgeous face. All right, so what I'll do now, Marima, is just do a couple of injections into the side of your mouth to help give you some support for your smile. So unfortunately, as we age, we do lose a lot of our fat pads and they get thinner, and gravity pulls everything down. So by injecting a little bit of filler into the oral commissures on both sides of the lips, it helps just to keep it upright, give it that extra support so that we reduce the effects of those marionette lines that can start to performing later on in the future. So again, into the oral commissure, just give it extra support. And usually I put either 0.05 of a mil or 0.1 of a mil. For this case, I'll be doing 0.05 of a mil. And then just squeezing in between my fingers to give that extra support. Perfect. Alrighty, so we've got a tiny bit left. I'm just going to see where to go next. Again, a few smiles for me. Big smiley and blowy kiss. Fantastic. Gosh, I think we're looking really good actually. It looks awesome. Really nice. I'm just going to touch up your Cupid's bow just one more time. So again, with the Cupid's bow, sharp scratch. Well done. Well done. That's the worst one. Perfect. And you can see with turning the needle, it really gives that nice curved look of the lips. Okay. Wonderful. Alrighty. And just pop your mouth open for me. Fabulous. Just a couple more threads and we're done. Wonderful, and there we have it. So now it's the most important part, which is the massaging of the lips. This is to help reduce any lumps or bumps that your patient or you may feel after your treatment. And it's also a really nice way of just relaxing after such a traumatic experience. And then I'll show you the final result, Marima. I can't wait to show you. It looks really nice. It looks really good. So always maintaining that nice clean area to avoid any risk of infections. Open your mouth for me, lovely. So I always make sure to clean my lips all the way through my procedure with chlorhexidine wash. Okay, so I'm just using some anaesthetic cream just to massage the area. So I'm going to do all the massaging for you, so you don't need to rub or touch your lips at all. So today, just stay away from them. You want to feel them, but try not to as much as possible. It's going to feel a bit funny just going into your mouth. So I can feel that the lumps are just dissolving underneath my hand, so I'm really just spreading them. With this particular filler, it is easy to move around and maneuver, so you can really just feel it and push all of those lumps away. And if you're worried about how much filler we're using, if you imagine that 1 ml of filler is only a third of a teaspoon, so it's a tiny amount of filler, but obviously in your small lip cavity, it will fill a lot more. Now I'm just going to shape the Cupid's bow as well. So this is just to make sure we keep that nice V shape of the Cupid's bow, so I hold it nice and still for about 10 seconds. And always making sure to feel the underside of the lip as well, to make sure there's no lumps there. Now, Marima, you will have some bruising. That is expected, so you can take some arnica tablets over the next couple of days, but it will settle down over the next sort of 4 to 5 days. And as I said, it will get more swollen tomorrow. If it does feel at all painful, you can take some Panadol or Nurofen if you need to. Beautiful. So what I'll do is I'll show you a mirror, sit you up. Have a feel again for me. Happy? Yeah. I think so. What have I done? No, they suit you really nicely. They look a lot more hydrated as well. So just swing your legs over, Marima, and we'll show you a mirror. Moment of truth. So remember, swelling will go down. couple of aftercare instructions for you. So swelling will go up tomorrow and then it will reduce down the next kind of 3 or 4 days or so. Don't rub or touch the areas. Don't sort of put any lipstick or any makeup or anything like that over the lips. Avoid any hot saunas or baths again for today. No vigorous exercise or running. You can have a couple of drinks of alcohol today, but not the whole bottle. And just remember, it takes about 2 weeks for it to fully form into your natural lips. So it will look even better in a couple of weeks' time. Well done.
Thank you.
Good, good. What I like as well is we've actually managed to reduce the defect on the top lip.
Oh yeah.
So it's reduced, yeah. Looks nice. We'll do some after pictures now, then I can show you before and after, and we can see how it's looking.
I think.
And a big smiley face. And a, ooh, gorgeous. 45 degrees that way. Gorgeous. And now the other way for me. Whoa, it's a big difference. Okay, I can't wait to show you. This is exciting. I'll save a few pictures and I'll show you them all at the same time. So now I'm just collating the before and after pictures for Marima, and I'm using an app called Treatment Pad, which is great because it gives you instant layouts of your pictures, before and afters. And just like that, you can see her pout is a lot bigger. Very exciting. Okay, so let's take a look. Before and after.
Oh wow.
It's a huge difference, isn't it?
It is.
Yeah, so you can even see as well, there is redness, yeah, it's hard to see past the redness, but there are fine lines. We call them smoker's lines or barcodes lines, but which tend to happen. I know you don't smoke, that's why we call them barcodes lines as well. But these happen because we're always using that muscle. So we start to develop these lines, but with lip filler, you can actually eliminate those lines because it just opens it out and spreads over the area. So for you, it has actually reduced them, which is great. And it's giving this nice, I think a lower lip, I think both of it looks good, but your lower lip has really popped out. It's giving some nice definition as well. Really hydrated your lips. It makes you look more youthful too as well. Your gorgeous lips. Look at that kiss. Gorgeous, absolutely gorgeous. And of course that will settle down, and then your smile as well. So with your smile previously, your top lip was quite thin and it sort of hid away, it was quite shy, but now it's come out and is saying hello, which looks really nice, really good, Marima. Gorgeous.
Cool.
Really nice, really nice lips, well done.
See this one?
It's amazing, isn't it? It's really good.
Difference.
It's massive. Of course, the redness will settle down in time, but I think it's really nice. I like the change. I think it's good that you went for this thicker product because it's giving you more volume and hydration as well, because your lips did look quite...
scar down.
It has, yeah, absolutely. This scar that you had here, isn't it? It's not even there anymore.
No.
It's magic, yeah. And some fine lines, like we all have these fine lines on our upper lips, but that's all gone as well. It looks really good.
Cool.
I'm excited to see what happens in a couple of weeks' time.
Okay.
When all the bruising settles down and all of the swelling settles as well. Yeah, well done. Thank you very much.
Thank you.
You're welcome, welcome. So that's wonderful. So there we have it, guys. So our lovely model has had 1 ml of dermal filler, a thicker product into her lip, giving her some nice volume, hydration, of giving that voom that she's been looking for all of these years. I can't wait to catch up with her in 2 weeks' time to see how her lips have settled down and what they look like then. Thank you so much, Marima.
Thank
I'll
you.
see you in a couple of weeks.
Thank you.
So there you have it. Thank you very much for watching. If you have any questions or comments, please don't hesitate to drop me a line in the comment section below. But for now, take care and stay healthy.